Hello, welcome to Live Talk with Dr. Choma for today. What are we talking about today? Before we go into what we are talking about, I want you to hit the subscribe button just below this video. And as you watch, don't forget to like this video, like the video, and when we are done, I want you to go to the comment section. You can give me your contributions, you can tell me your experiences and all that. Okay, what are we talking about today? We're talking about uterine fibroids. I'm sure if you've lived in Nigeria long enough, if you've known a lot of women, you hear about fibroids everywhere. So we're going to talk about something that is so common to so many women in the country, in Africa, as blacks all over the world. Okay, so what are uterine fibroids? Uterine fibroids are actually non-cancerous tumors. Do not be scared when you hear tumor. Tumor just means a growth. Tumor means a growth. So, fibroids are non-cancerous growths that happen in the womb. So it can have different locations, from the lining of the womb inside to inside the muscle of the womb to outside the womb. The womb is what we call uterus in medical terms, but any other person can call it the womb, where you carry your child, where you carry your baby when you're pregnant. So that is the womb. So uterine fibroids actually occur in the womb, and fibroids can occur just singly, like one, or they can occur in clusters, a lot in one place, and they can be as little as a seed, and some can grow as big as a watermelon. When you see this person, they're looking like they're pregnant. So fibroids, they can grow, they can shrink, and all that. So let's talk about them. So fibroids are so common that they occur in about 40 to 80% of all women. That is a large number. If you have 10 women, about 4 to 8 of them are going to have fibroids. So you can see how common it is, especially in black women. It has been found much more commoner, in women that are black, whether you're a black American or you're African or you're Nigerian. It is very common. And not just common, it shows more symptoms in blacks. So some people can have it and they don't have any issues at all with fibroids throughout their lives, but it is found to be more symptomatic in blacks. So what are the risk factors? What is the cause first of these fibroids, uterine fibroids? The truth is that the cause of fibroid is not really known. That's the truth. It's not really known what causes fibroid, but it is said to be associated with the female hormones estrogen and progesterone. So now you know that it's not your fault. It's just your body. I mean, as a woman, you need to produce estrogen, you need to produce progesterone, and these are the hormones, your natural female hormones, and those are the things that work hand in hand, that contribute to the growth, to the shrinkage, to the development of fibroids. So it is not your fault. Don't ever think it's your fault that you have fibroids. So what are the risk factors, that can expose someone to fibroid? As I said, the cause is not known. A lot of us, have fibroids. That's the truth. A lot of us, we are going to have some symptoms or not, or we're going to live with fibroids for a while. Some of the risk factors, these are just general risk factors that predispose anyone to any disease. So first is obesity. As I always say, you have to watch your weight, you have to watch your diet, you have to, make sure your BMI is at the appropriate place, you have the right measurements. Second is family history. If there is someone in your family that has had, that is living with fibroid, your mother, your sister, there's a higher chance of you experiencing fibroids too in your lifetime. The third is early menarche. And early menarche means early age of onset of your menses or your period. So those that have menarche before 10 years, they are at risk of developing this. Also late menopause, that means people that have not had their menopause past 50 years, So these fibroids occur at a woman's reproductive age, so because that is when they're exposed to hormones. So if the period of time when you're exposed to these hormones are longer, of course, it will just mean that your risk is increased. So that's what happens in early menarche and late menopause, meaning that the time that the woman is exposed, the time frame the woman is exposed to the female hormones is extended, because your period starts at an early age and menopause comes at a later age. Then the next is race. This has been found to be commoner in women, in black people, whether it's said to occur at the younger ages in black women, and it's also said to be more symptomatic, and black women have been noted to have larger fibroids. Next risk factor is excessive alcohol and low vitamin D. So as I've always said, alcohol is not good for anything at all. It's not good for any kind of illness. It's not protective at all for anything. So another thing is low vitamin D. That is another risk factor. So those are the risk factors. I earlier said that about 40 to 80% of women are going to have fibroids. So that is quite a large number. But the good thing about it is that as much as almost all the women you might meet in this world have fibroids, most of us are going to be asymptomatic. That means we're not going to experience any symptoms. We can go through our whole life without feeling any symptoms that point to fibroids, right? So me for one, I didn't know I had fibroids till I got pregnant. It was during the pregnancy. I had some bad pain and I was like, this is not normal. I went to the hospital and they said, you're having fibroids, and that's what is causing you pain. You have fibroids and that is what is causing you pain, sorry. And that was how I knew I had fibroids. Even after the babies, I've not had any pain again. So you can imagine, the symptoms are gone. So I can live all through my life without having those symptoms ever again. But the fibroids are there. Yes, they are there, but no symptoms. So let's talk about the symptoms that we can see that might make us suspect uterine fibroids. The first is excessive bleeding or excessive pain while you're on your period. Now, our period is a very important thing as women, so we should always take note. If your period changes by one day, you should be able to notice. If your cycle changes by some day, you should be able to notice. If you're experiencing extra pain, you should be able to notice. Our period points to a lot that happens in our womb and in our uterus, so we should always take note. So when you're experiencing more blood loss than usual, than you used to have before in your period, is something to take note of. And if your period that was previously painless becomes painful, that is something to watch out for. Another is bleeding between periods. I mean, you're done with your period, you know that your period is in maybe 28 days, but you're bleeding in between your cycle. That is another that's another symptom that could come with uterine fibroids. So another symptom you could experience is bloating or feeling of fullness in your lower abdomen. You always feel like, I'm bloated, at this lower part of your abdomen, you always feel that way. Another is pain during sexual intercourse. That is another symptom of fibroid. You should check it out. If you always feel pain when you're having sex, then it's something to worry about. Then it could also come, especially when a fibroid is getting bigger in size, it could come with frequent urination. That means it keeps putting pressure on your bladder. These structures are related. The bladder is in front, the uterus is in the middle, and then you have the rectum at the back. So anything that affects them, any of these can affect the other one. So if the uterine fibroid is a bit big, it can put pressure on your bladder and it can cause frequent urination. That means you urinate almost every time. You feel like urinating all the time. Next is low back pain, because it's putting pressure on your pelvis and your back, so you experience low back pain. Then if it's putting pressure on your rectum, you might experience constipation. So that is another symptom, frequent constipation. And a person can come with long-term vaginal discharge. You've tried everything, but you still keep having a vaginal discharge. Then if it is so massive, the fibroid is so big, there could be inability to pee, or you don't just pee completely. You're not able to empty your bladder. That means it's blocking your bladder and you're not able to pee. At this point, it's almost like an emergency and you need to come to the hospital, because you cannot stay without, emptying your bladder. Then some, if it's also massive, you can see enlargement of the abdomen. You can see a person looking like they're pregnant but they are not. You can see someone with their tummy so big, but it's not fat. It's not because they are eating too much. No, it's just because there is a fibroid growing in there. So most times in these climbs, we do not take care of things early enough, and when we are taking care of them, it has become complicated. We are having complications, not just because I almost feel like we have a phobia for going to the hospital. So even when you're feeling something, you're just like, okay, I'm not checking it out, it will pass and all that. So most times we see people coming down with complications, and that is when they come or they present to the hospital. So what are the complications that could come from uterine fibroids? Usually the complications are what brings people to the hospital. First is chronic pain. You're always in pain. You're having abdominal and pelvic pain. This pain doesn't go away. You take painkillers, it goes for a few seconds, a few hours or something, and it comes back. You're always in pain. This is a complication that could come from the pressure of the uterine fibroid. Second is anemia. Remember, among the symptoms I talked about excessive bleeding. This bleeding could be so much because for fibroids to grow, they need blood supply, and a lot of blood supply is going into that fibroid to enable it to grow. It's almost like a baby taking a lot from you, taking the blood and all that. So you see that there is a lot of blood supply to the fibroid, making you, bleed into that fibroid or lose a lot of blood. And when you bleed into that fibroid and it's time for your period and the lines of the womb is shedding, a lot of blood goes with it. So a person could come down with anemia, like serious anemia. There's some people that every time they check their blood, it is always low. Some people, and what are the symptoms of this anemia? You could always feel faint. You're always feeling weak. You're always feeling dizzy. You could faint, at times from the low level of blood. Another complication we see is very painful periods. I mean, periods that are so painful that you cannot do anything, you cannot function. That is a complication. The pain is so much that you cannot do anything. I'm sure you've seen people like that. They cannot lie down, they cannot do anything, they have to stay off work, they have to take time off work, they cannot just function. That is a complication. Very painful periods. Then the next that is always so important for everybody, every woman, every man in Africa and in Nigeria is infertility. Now, fibroids can be a cause of infertility or a cause of pregnancy loss, a cause of infertility that they could occupy a large space in the womb. So such space in the womb that pregnancy cannot implant, or when pregnancy implants there is not enough space for the baby to grow, and it can cause you to lose the fetus. So that is the way it can cause infertility, especially the ones that grow inside the womb, inside the lining of the womb. Those ones are the ones that can cause infertility and can cause you to lose pregnancies at a very tender time, or at any point in pregnancy it can cause you to lose them. Then some of the complications are seen during pregnancy itself. As I told you, I had pain, so we call that red degeneration. So sometimes if you have you have fibroids and you're pregnant, what happens? The body gives blood more to the baby, and what happens? It starves the fibroid of blood supply, and when that happens, the fibroid starts to die. And when it starts, when blood supply gets cut off and it starts dying or something, you start feeling pain. That pain is what we call red degeneration. And if you're pregnant and you start feeling some kind of very severe pain while pregnant, it could mean that you have fibroid. You need to go to hospital to see a scan, and usually we do not do anything for that. We just give pain medication. The pain passes. After a while you're all right, and most times after the pregnancy the pain goes away. Then also in pregnancy it can cause if it's so big, it can cause, those pregnancy losses I talked about. It can cause the placenta to separate from the lining of the womb. It can cause, we call it placenta abruption. So it can cause the placenta to separate from the lining of the womb. Then secondly, it can make your baby not grow well. If the blood supply to your baby and the nutrients are shared or divided, the baby is not getting enough, the fibroid is taking more, what happens is that it could cause some fetal growth restriction. So your baby is not going to grow as much as they are supposed to. Then another thing could cause is preterm delivery before 37 weeks. If the fibroid is so much that it's taking up the space, so it could cause you to start contracting earlier than normal, or there is no space anymore and it can make you go into labor earlier than you're supposed to. So how do we diagnose? So when you see all the symptoms or you feel the pain that we're talking about, what do? Please, you need to go to a hospital, especially if you're pregnant. Please do not take, I tell pregnant, any pain you're feeling during pregnancy is not normal. It's not normal. I know sometimes you say, waist pain is normal. Some things are not normal. You need to check it out first, especially if you're pregnant. It's better they check it out and they say, it's nothing and you're okay. It's nothing and you get some painkillers and you're alright, than for you to say it's nothing and you stay at home and the worst happens. As I said, when we have symptoms, we have to go to the hospital. But the truth is that as many of us are going to be symptomatic, we might not require any treatment, because by the time you get to menopause, your body is not producing as much hormones as you usually would do. Most times these fibroids shrink and they don't bother you at all throughout your lifetime. But if you have symptoms, then yes, you should get treatment. And the treatment depends on the severity. The treatment that your gynecologist is going to give you is going to depend on a number of factors. It's going to depend on the fibroid, the number of fibroids you have, how they are growing, whether they are single, whether in clusters, the size of the fibroids, whether it's like a granite or it's like a watermelon, or it's in between, the location of the fibroids is going to determine the treatment you're going to be given, whether it's inside the muscle or outside. Then the symptoms you're experiencing, if they are life-threatening, they're going to determine your treatment. If you're having anemia, excessive bleeding, that is going to determine the treatment you're going to be given. Then we have desire to keep your uterus, maybe you want to have your babies later, or you've not had babies yet. That is going to determine the kind of treatment you're going to have. The first and simplest treatment anybody can get, they are medications. We have over-the-counter pain medications. That's your paracetamol, your ibuprofen, things that will lessen your pain. So first, that is the first line. You're feeling pain, you have to take some painkillers. The second, if there is anemia or anything, you can get iron supplements just to help, especially during your period when you're losing blood. Some people, birth control sometimes can reduce the bleeding. So this depends, as I said, it depends on if your doctor has checked you, assessed your symptoms. They can determine what drugs to give you. There are different drugs that can reduce your bleeding, drugs that can reduce your pain, all that. So that's just it. So these are some of the drugs that you can be given. Then the second thing is surgery. The first surgery you can get is a myomectomy. We call it myomectomy, and it's just removal of the fibroids. It's usually done for people that have a desire to keep their womb. They don't want to remove the womb and all that. So they do a myomectomy where you just go in and remove these fibroids, wherever they are, wherever their location. So the kind of myomectomy to be done, it will be determined by the kind of fibroid. There are some that they go through the vagina with a scope and take the fibroids. Some they cut a tiny hole in the abdomen and do that. Some they have to cut you open, a proper open surgery to remove the fibroids. So it's just going to, so the type of fibroids you have and the symptoms will determine the kind of myomectomy you're going to do. Then the third thing is another surgery, but this is the cure. This is the only cure for fibroids. nothing you're going to, even some drugs that they take to shrink the fibroids will only shrink it temporarily. In fact, they give you some drugs if a person has a very huge fibroid. They give you this drug to shrink the fibroid before they do the surgery. So no drug in this world is going to take off the fibroids. No, it's only surgery that takes off the fibroid, and the only thing that can cure fibroids finally, that it will not come back again. You know, even when you do a myomectomy, there is a chance that the fibroids will reoccur, as we saw in the case of the actress that talked about hers. She had a myomectomy and the fibroids reoccurred. It's something that is going to happen because your body is still exposed to these female reproductive hormones. Whether you like it or not, it can regrow, it can reoccur. Even if you take just to shrink them, all the herbal drugs in the world, it can reoccur. So please, herbal drugs, they don't cure it. The only thing that can cure uterine fibroids is removing the womb, which is called hysterectomy. That is the only cure medically for the fibroid, removing the womb. So that is it, just to remove the womb. I mean, if there is no womb, the hormones cannot act on anything. There is no way fibroids can grow, so that's just it. There are other modern methods which involve clipping the artery, or clipping the artery to the fibroid to stop blood supply to the fibroids and stop it from growing. But it doesn't mean that fibroids cannot regrow in other places in the womb. So that's just it. So the cure, the absolute cure to fibroids is removal of the womb. So how do we prevent fibroids? To be honest and to be truthful, you cannot prevent fibroids because there's nothing you can really do that can prevent fibroids. If you have fibroids, you have fibroids. If fibroids want to grow, they are going to grow. Nothing. The only thing you can do for yourself is to live a healthy lifestyle. That means, remember I talked about vitamin D, low vitamin D being a risk factor. So you have to make sure your meal is balanced. If you're taking vitamin D and you leave all the other classes of food, it's not going to help you. So please, you need to make sure your food is balanced at all times. Vegetables that will give vitamin D, the green leafy ones, they are good with vitamin D. Early morning sun, carbohydrates, proteins in their proper quantity to give you enough iron, to give you enough vitamins, to produce blood and all that, to give your body enough nutrients to grow and all they need for their repairs. The second is exercise. Exercise is always important. Exercise will increase blood flow to other parts of your body. Exercise is going to help you live a healthy lifestyle generally. So to be honest, nothing will prevent fibroids. If you're going to have fibroids, if you have fibroids, you have fibroids. The only thing is just to pray that you do not have symptoms or get symptomatic. You cannot stop yourself from having female hormones. They are important for you as a woman. They're important for you to have your periods. They're important for you to get pregnant, to keep pregnant, to get pregnant. It's important to keep your pregnancy. It's even important when you're giving birth. So to be honest, you cannot avoid it. As long as these hormones are part of a woman, they are going to be fibroids. So please, my dear beautiful and strong ladies and women, fibroids are not your fault. It's not as a result of what you eat. I saw sometime there were some studies about relaxer and fibroids. To be honest, some people have natural hair. They still have fibroids. They've not relaxed their hair from birth till now, and they still have fibroids. So what has relaxer got to do with that? They still have fibroids, and their fibroids are symptomatic. So please, the truth is, you just need to live a healthy life. If you feel that relaxing your hair is not healthy, you don't like putting chemicals, fine. That is just a healthy way of living. Please avoid it if you want to. But my own is just to tell you that it doesn't really have an effect. It does not have an effect because your hormones are responsible. They are the things that have been implicated, and you need your hormones throughout your reproductive age. The only time you're not going to have fibroids is before you have your periods, and after your periods have stopped. So please do not blame yourself. Do not think it's your fault. Do not beat yourself up. That is how you came. You came with it. There's nothing you can do about it. Just live a general healthy lifestyle, good food, balanced diet, exercise, keep mobile, have enough rest and all that. Those things contribute generally to your good health and a healthy lifestyle. But if you have fibroids, there's nothing you could have done. There's nothing you would have done that could have prevented it. And please, men, husbands, you have to understand this and be empathetic towards your spouses, towards your partners, and know that they just need your support. Sometimes these things are just symptoms that will come and go. They don't need to do anything. But if some interventions need to be done, they need your support. Please, it's not time to castigate. Oh, women, you poo, is what you eat, is your lifestyle, is this. Those things do not have any bearing in the occurrence of fibroids. I hope you have been able to learn something today. Please share this video if you feel someone is going to benefit from it. Secondly, I want you to like this video, and do not forget to comment if you have any contributions or experiences to share. Thank you very much. See you next time.